you can see the big one here is going to be phenylbutazone overages, okay? And that's pretty much what you'd expect. And then the smaller ones are tranquilizers, and then this is joint therapy, again, non-steroidal here, flunixin, banamine, and then acepromazine, the most commonly used tranq, and commonly in the hands of horse people, and so that's how they get themselves in trouble that way with that drug. And we'll talk about why that is. So quick breakdown, some are antihistamines, some are sedatives, some are corticosteroids. The majority are non-steroidals, NSAIDs, so non-steroidal anti-inflammatory drugs. Okay, and then here's how the others break down. We had cocaine, pentoxyphylline, testosterone. So there's three categories of USEF drugs. So permitted substance, so these are substances where the use is not regulated by USEF. And to give you an example that always surprises people here is isoxaprine. In USEF, we don't regulate it. Okay? Okay? And then there are restricted substances, and the one that means that we regulate that to the specific that you cannot have more than this amount in the horse's blood at time of competition. Very specific, okay? So the classic here is bute, 15 micrograms per ml of bute in the system at time of competition. And then we give guidelines to help you stay within that, okay? So permitted substances that are not regulated, restricted substances, a very specific group of substances, primarily the non-steroidal anti-inflammatory drugs, okay, primarily, okay? And those are okay to use, and you don't need to fill out a form for them, with one new exception. And we're going to talk about that, the new part of the rule, okay? And then forbidden substances. Okay, now forbidden sounds very foreboding, okay? But understand that we as veterinarians and you as horse owners, you use and we use forbidden substances in the horse commonly, okay? And so there's a provision for some of the common treatment substances to go ahead and fill out a form, a medication form, and withdraw the horse for 24 hours and still have it show with that substance in the bloodstream or urine. Okay, and we'll talk more about that.